Welcome to Round 5 of the Parenting Roundabout podcast for the week of January 30th. I'm Terry Morrow, and I'm here with Catherine Holeko.
Hello.
And Nicole Eridix.
Hi there.
Today we're taking a break from talking and complaining and obsessing and instead shouting out things other people are doing that we think you'll find as useful or enjoyable as we do. We call this our Roundabout Roundup. So I guess I will shout out Summit Health, which is... I was looking for a new doctor, and I asked on Facebook people who live in my town, where do you go for the doctor? And amazingly, all of them went to this Summit Health. And it's like, well, I've never really heard of that, but I'll go there. And it was very nice. It's one of these things where they have lots of different specialists under their same umbrella. So if your primary care person refers you to a specialist, you don't have to get a referral. You don't have to do anything. It's all in the same computer system. You go out from your doctor. You make an appointment with the specialist at the desk, by his office. And you go to the specialist. The specialist can call up on the computer and see all your records, everybody that you've seen, all the medications you're taking, everything about you. A little spooky, but also very cool. If you've ever had to get a referral and then you go to the office, I forgot the referral, I have to go back home and get the referral, and then the insurance doesn't, everything is coordinated.
Right.
It's super cool. And they keep assimilating more and more small practices, and they keep getting bigger and bigger, and they merged with an urgent care provider in New York and New Jersey called CityMD. So now they have the urgent care under their umbrella. And then they in turn have been assimilated by a nationwide medical, I don't know what you even call these, corporate medicine, one of the nurses called it. It was like, I didn't go into this to be part of corporate medicine, but she is. And she will be, because probably at some point that's all there's going to be.
Right.
But even though I'm a little uncomfortable by, hey, if all the specialists are under the same umbrella, do they have a benefit for referring you to other people? Because I've seen a lot of doctors lately. Maybe they're like, okay, I've only done 5 referrals this week. Who else can I send this person to? Oh,
Right.
I know.
Right.
But the convenience of it, and that, it's all on the same patient portal. You can go in there, you can write notes to all your doctors. It's they've just built this new facility in our town that is, it's used to be a humongous office building. Now it's a humongous healthcare emporium where they do all the testing and they process the lab tests. So you get your lab test done where you go to your doctor, and then they do it like the next, you get it immediately.
Right.
It's really very impressive. And I'm mostly happy with it. Two complaints I would make Summit Health is, number one, there's a lot of ways for the patients to talk to the doctors online, and that's great. Do the doctors ever talk to each other? Because I've been in a couple of situations where one doctor tells me one thing, another doctor tells me another thing, and I'm like, I don't want to have to go back to the first doctor and say, hey, Dr. 2 said you are wrong.
Yeah.
That should not be my place. They should get into that themselves, I think. Don't you? There needs, or there should be like an ombuds person who shepherds you through the process. And,
Right.
We'll be the one who sits down, Dr. 1 and Dr. 2, and says, hey, could you guys agree and not confuse the patient?
Right.
And the second thing is, in creating this new building in our town, and I guess in all these mergers they've been doing, they've decided that all the nurses and all the people who sit behind desks and make appointments and stuff all have to wear the same color scrubs. It used to be by department. Now they're all the same. And the color they have chosen for the overwhelming color scheme of people working at a medical thing is black. It's like you're going to a wake. Everybody's in black. Am I at my funeral? Are you trying to tell me something? You shouldn't go to an oncologist and have everybody be wearing black.
Hikes. Okay.
A nice navy blue, a nice royal blue, maybe some teal, purple. Look alive, people. But other than that, I am here to sing the praises of monster mega medicine. They will sooner or later assimilate you too. It'll be fine. You'll enjoy it.
Right.
I have a lot of tests right now. It's like
spending a lot of time
with all
there.
These labs. We got to give people tests, people. Come on. Anyway, Nicole, what do you got this week? And how you feeling? I got a good doctor for you.
Well, my last computer, I think my laptop, I had a laptop, and it lasted me for a couple of years, but it eventually, the keyboard kind of gave out, and keys broke and keys didn't work and keys got stuck, and upon further investigation, there was a lot of dirt and crumbs under there. So unfortunately, it was too late when I discovered that and had to go get myself another laptop. So I'm determined to not let that happen to this one. And so I found a little kit on Amazon that will allow me to clean it. I mean, it's not going to be obviously 100%, and I don't even know what the value is, but it makes me feel better. And it's, it's a very reasonable price. It's got all kinds of handy little tools for cleaning your computer, your keyboard, like a little puffer to get the dust off, and the brushes and wipes, and it's just all kinds of knickknacks in there to help you keep your keyboard and your computer screen visibly surface clean, at least. So, because if you're like me, I have food and drink around my laptop all the time and my computer all the time. So yeah, things can go south real fast. And then so yeah, I totally recommend this little computer cleaning kit on Amazon.
Cool. And Catherine, what do you have this week?
Well, just because we all need another reason to look at our phones and another social media thing in our world, I joined BeReal.
I haven't done that yet. You're ahead of me.
Yeah. So the way it works is you get a notification and you have 2 minutes to take a picture. And it simultaneously takes a picture with the front-facing camera and the other camera. So it takes a selfie at the same time it takes a picture of whatever you're in front of or doing or whatever. And I was telling Terry before, I cannot figure out how to do a flattering angle on a selfie. Like, it's so something I am not getting. But like, that's part of the reason. Like, the selfie is pretty small, and it helps me to just be like, just share something and don't spend half an hour.
You, Catherine.
Don't spend all this time like trying to figure out if you look cute or whatever. You just, and I have like 4 or 5 friends right now. So it's just kind of a fun little social media like experiment to do. So, and you can't, you get the notification just whenever you get it. So you can't be like, oh, this is so cute, I should take a picture and use it for my BeReal. No, you just have to do what you get. So you can save that other stuff for Instagram. So yeah. So I just thought, I don't know, it seemed kind of fun, and it seemed like a way to like be a little more humble about your pictures, about your selfies. So I'm trying it out, and so far it's fun. So
awesome.
There you have it. Be real. And that's it for another week of Parenting Roundabout. If you missed any of our earlier episodes this week, look them up on Spreaker, Apple Podcasts, Amazon Music, or wherever you get your podcasts to hear what we had to say about movie-worthy events in our lives. Sea creatures, just listen to that one so you understand what we're talking about. And supporting a young adult when things go wrong or get difficult. You can also find all our episodes at parentingroundabout.com and talk back in the comments there, on our Facebook page, or on Twitter, where you'll find us at Roundabout Chat. And please visit our Amazon shop at amazon.com/shop/momitude, where you can find links to a lot of the things that we talk about. Have a great weekend, and we'll see you back here on Monday.